Back pain can make getting through the day hard and make getting a good night's sleep even harder. This might make it difficult for you even to be able to get in and out of bed without agony. Hi viewers, and welcome back to Bestie. Lower back pain and poor sleep have a two-way relationship, meaning one intensifies the other. Back pain makes it difficult to get comfortable in bed, resulting in reduced muscle recovery and poor sleep, which can further intensify the pain. Good sleep is essential to your overall well-being, so if you have trouble sleeping because of lower back pain, keep watching today's video where we'll tell you the best sleeping positions and tips to help with lower back pain. From sleeping on your stomach with knee support, the fetal position, alternating sides, practicing good sleep hygiene, to using the right pillows and more. Watch until the end to learn about all of them. Number 1. On the back with knee support. Lying on the back evenly distributes the body's weight, helping to minimize pressure. It also ensures a good alignment of the head, neck, and spine. Placing a small pillow under your knees can provide additional support and help maintain the natural curve of your spine. To get comfortable in this position, lie flat on your back facing the ceiling. Avoid tilting your head sideways. Position a pillow to support the head and neck. Place a small pillow under the knees. For extra support, fill any other gaps between the body and mattress with additional pillows. Try placing one beneath your lower back. What type of position do you sleep in most often? Is it your back, stomach, or side? Tell us quickly down below in the comments section. Number 2. On the stomach with knee support. Stomach sleeping is hard on the back and not recommended for people who suffer from lower back pain. However, if you struggle to sleep on your side or back, start placing a pillow under your hips. The extra cushion prevents your back from curving unnaturally and reduces the pressure on your lumbar spine. Also, use a thin pillow under your head or no pillow at all so your head doesn't curve backwards and result in further pain. Number 3. On the side with hips stacked. If you're a side sleeper, place a firm, flat pillow between your knees. The pillow will align your lower spine with your hips and prevent the leg on top from creating pressure on your lower back and pelvis. This position also helps relieve stresses on your lower spine, creating room for your spinal nerves. Use a head pillow to slightly raise your head so that your shoulders are in alignment. While sleeping on your side, you may also consider using a lumbar support cushion or waist pillow under your waist. This pillow will help maintain alignment between your ribs and pelvis for upper and lower back support. Number 4. Upright position. Many people find relief for both back and neck pain by sleeping in an upright position or in a recliner. This is common among pregnant women for their back pain. If you choose this position, the best accompaniment is a horseshoe-shaped pillow to support the neck, such as the kind often used on airplane flights. Lower back pillows are also a good idea. Number 5. Fetal position. If you have back pain or herniated discs, you may want to try sleeping on your side curled in the fetal position. Your discs are soft cushions between the vertebrae in your spine. Herniation happens when part of the disc pushes out of its normal space, causing nerve pain, weakness, and more. Curling your torso into a fetal position opens the space between the vertebrae. Lie on your back and then roll over gently onto your side. Tuck your knees towards your chest and gently curl your torso towards your knees. Remember to switch sides from time to time to prevent any imbalances. Although curling up while sleeping on your side may provide a nestled feeling, but make sure not to curl too tight. This can restrict your breathing and leave you with a sore back, especially if you have spinal osteoarthritis. Number 6. On the stomach with pillow under your abdomen. You may have heard that sleeping on your stomach is actually bad for back pain. This is partly true because it may add stress to your neck. But if you find yourself resting on your stomach, you don't have to force another position. This is a good position for people who have degenerative disc disease. They can benefit from sleeping with a pillow under their stomach. It can relieve any stress that's placed on the space between your discs. Place a pillow under your pelvis and lower abdomen to relieve some pressure off your back. Depending on how this position feels, you may or may not choose to use a pillow under your head. Number 7. On the front with your head down. If you sleep on the front with your head facing one side, you may twist your spine. This may also put unnecessary stress on your back, neck, and shoulders. You can prevent this by simply lying with your face down. It's also a good idea to use a small pillow under your stomach and add another one to lift your forehead. Number 8. Use the right pillows. Pillows are not just for your head and neck. Depending on your sleeping position, additional pillows can help keep your spine in proper position. The pillow for your head should support the natural curve of your neck and be comfortable. A pillow that's too high can put your neck in a position that causes muscle strain on your back, neck, and shoulders. Choose a pillow that'll help keep your neck aligned with your chest and lower back. Your pillow should be adjustable to allow you to sleep in different positions. Replace your pillows every year or so. Did you know that using the wrong pillows can cause acne as well? To know how you can get rid of this skin problem, watch this video titled 7 Easy Ways to Clear Up Your Acne. Now, back to sleeping positions and alignment tips if you have lower back pain. Number 9. Watch out for sleep apnea. Sleep apnea, which is marked by pauses in breathing while sleeping, can sometimes travel with low back pain. The two conditions do share some risk factors, which is obesity. Some of the pain medications that treat low back pain also slow down breathing, which can worsen sleep apnea symptoms. Getting a diagnosis and treating sleep apnea or any underlying sleep disorder will have spillover benefits for low back pain as well. Back sleeping may be one of the best for back pain, but it can make sleep apnea worse. Gravity causes your jaw, tongue, and soft palate to drop backward towards your throat, narrowing the airways. This can lead to a blocked airflow and trouble breathing. Number 10. Alternate sides if you're a side sleeper. Some evidence suggests that habitually sleeping on one side of an ill-fitted mattress may contribute to muscle imbalance and pain. Always sleeping on the same side suspends the middle of your body between your hips and your shoulders, the broadest parts of your trunk. So try to alternate your side of sleeping every day. Number 11. Practice better sleep hygiene. Back pain can significantly disrupt sleep. Even so, it's best to try to maintain a regular schedule with consistent sleep and wake times, rather than sleeping in to compensate for lost sleep. Most adults need 7 to 9 hours of sleep in a 24-hour period. Try avoiding stimulants such as caffeine in the evenings. Don't do heavy exercise in the hours leading up to bedtime. Winding down before bed by reading, taking a warm bath, listening to relaxing music, or doing gentle yoga can also help you sleep better. You should also make the bedroom a relaxing place by dimming the lights and removing distractions such as computers, phones, or TVs. Number 12. Choose the correct mattress. The type of mattress you need depends on your body type. A soft mattress can be good if your hips are wider than your waist because it'll let your spine stay straight while you sleep. If your hips and waist already line up straight, a harder mattress might feel better because it'll give you more support. Doctors used to always recommend firm mattresses, but research has shown that people with low back pain actually sleep worse on a very hard mattress when compared to other kinds. But soft mattresses can also cause problems too. You may sink too deep and your joints may twist and cause you more pain. Try sleeping on different kinds of mattresses, either at a friend's house or in hotels to see what feels best. If you think a harder mattress might help, put a sheet of plywood between your mattress and the box spring. You can also try a few nights with your mattress on the floor to see if the extra support makes a difference in your pain. Number 13. Be careful getting in and out of bed. Many back injuries are attributed to making awkward movements when doing routine things. One of the easier ways to prevent new injuries or exacerbating old ones is to be conscious of your movements. Don't twist your back or make rapid jerking movements. Get in bed by sitting on the edge of the mattress. Support yourself with your hands, bend your knees, and lay on your side. Then adjust the position as needed. Get out of bed by rolling your side facing the edge of the mattress and bend in your knees. Supporting yourself with your hands, carefully swing your legs to the floor and stand up straight. While these sleeping positions can ease lower back pain and help you sleep better, there are other things you can do to fall asleep easier. Learn more by watching 10 life hacks to get a good night's sleep, or learning about the best foods that'll help you sleep better instantly. These 2 videos will definitely help you sleep better, leading to good physical and mental health. So go ahead and watch them for maximum benefits. How many hours do you sleep a night on average? Let us know in the comment section.